Are you constantly tired, even after a good night's sleep? Do you find yourself forgetting simple words? Or maybe you've noticed a strange tingling or persistent weakness in your feet or legs. If you're over 60, you've probably been told this is just a normal part of getting older. You may have even worried that it's the start of dementia. But what if those frightening symptoms are actually the warning signs of a silent, treatable deficiency? What if you are experiencing fake aging? Today, we're going to expose the B12 mistake that 40% of older adults are making. This isn't just about diet. It's about what happens when your body stops absorbing this crucial nutrient and the specific supplement your doctor might not be telling you about. The symptoms that mimic aging. Let's start with the symptoms, because B12 deficiency is known as the Great Masquerader. It directly impacts the parts of your body your favorite health videos warn you about. First, the brain fog. If you're watching videos about brain health and memory loss, you need to know this. Low B12 can cause confusion, poor memory, depression, and difficulty concentrating. It's essential for maintaining the myelin sheath, the protective coating around your nerves. Second, the leg weakness and tingling. Your audience is desperate for solutions for weak legs in seniors. This tingling, or that persistent pins and needles feeling, especially in your hands and feet, is a classic sign of B12-related peripheral neuropathy. This nerve damage makes your legs feel weak, affects your balance, and dramatically increases your risk of falling. The real reason absorption fails. Here is the most critical piece of information and why simply eating more meat or taking a cheap B12 pill often fails. The problem isn't usually intake, it's absorption. As we age, our stomach often produces less stomach acid and less intrinsic factor. You need both of these things to break B12 away from food proteins so your body can actually use it. If you're low on acid, the B12 just passes right through. This is a huge warning for those of you taking popular medications. If you take Metformin for diabetes or any kind of acid-reducing drug like a proton pump inhibitor, think omeprazole or lansoprazole, you are dramatically increasing your risk for this exact deficiency. So the solutions and the right supplement. We have two key steps, and the first is about getting the right answer. Step 1, get the right test. A standard B12 test can often be misleading. Ask your doctor to specifically check your methylmalonic acid MMA and homocysteine levels. These markers elevate earlier than B12, giving you a clear picture of whether you have a true tissue-level deficiency. Step 2, choose the right form. Since your digestion may be compromised, you need to bypass the stomach. This is why sublingual B12, that's the one you put under your tongue, is often the better choice. Also, look for the active forms, Methylcobalamin or Adenosylcobalamin. These are the ready-to-use versions that don't require your body to do extra work. While Cyanocobalamin is cheap and common, the active forms are often preferred for severe neurological symptoms. Don't settle for "it's just old age." Take this script, talk to your doctor, and find out if a simple B12 fix could reverse your fatigue, lift your brain fog, and bring the strength back to your legs. If you found this doctor-backed information useful, hit that like button, subscribe for more health explanations, and let me know in the comments, are you currently taking metformin or a stomach acid blocker? I want to hear from you.